Well, the research is clear. Safe injection sites save lives, reduce drug overdoses, and limit the spread of diseases. That is according to Toronto's medical officer of health. David McEwen is now calling for 3 safe injection sites to open in that city.
So in addition to rising rates of fatal overdoses, rates of HIV and hepatitis C among people who inject drugs are higher than for the general population. A recent study found that about a third of people who are injecting drugs did so in public places such as washrooms and alleyways.
David McEwen, Toronto's top health official. Well, if the controversial sites are approved, Toronto would be the second city in Canada to host one after Vancouver. Our next guest plans to reopen the conversation here in Ottawa. Rob Boyd heads up the OASIS program at the Sandy Hill Community Health Centre, which works with drug users, and he joins me in the studio. Hi, Rob.
Good morning.
What did you make of that announcement yesterday about Toronto calling for 3 safe injection sites?
I think that's great news for Toronto and Torontonians, and I think it's demonstrating some great leadership with Toronto Public Health and the local community health centres.
How frustrated have you been? Because we have talked before on this program, and nothing is moving here in Ottawa yet. Why does that concern you and frustrate you?
I don't know if I would say I'm frustrated. I mean, I think that I'm the work that I do, you have to get used to slow rates of change for folks. And so if I gave up easily, this would not be the type of business that I should be in. So we have continued to move on this as a community health centre, moving it forward, and we're going to continue to do so in the next couple of months.
The police chief has been on this program before. The mayor has been on this program before. They are both not in favour of safe injection sites. Without their support, can you get them here?
We would love to have the mayor and the chief of police being supportive of this, but at a certain point we might need to recognize that if they're unwilling or unable to provide that support, that we do need to just move ahead without that support. What we will require from them for exemption is a letter expressing their opinions of the service that we're proposing that needs to be included with the submission.
So it doesn't have to be a letter of support necessarily, but a letter of opinion.
That's correct. So the Minister of Health would take that letter and weigh it against the evidence that we're presenting and the service model that we're presenting, and then make a decision.
One of the reasons why Toronto's public health chief is calling on this now is because they are seeing a spike in overdose rates. Is that an issue here?
I'm not sure that we have seen yet a spike in overdose rates, but we are concerned that there is one coming. We in Ottawa have recently found that there's powdered fentanyl available, bootleg fentanyl, and this is what is driving the increase in overdoses in BC and Alberta. So we have an ongoing high level of overdose within this population, and we're concerned that there's going to be a spike coming shortly.
Powdered fentanyl, and why is that important?
It's important because when somebody is using a fentanyl patch, it's fairly clear what it is that they're using. However, the powdered fentanyl is being mixed in powder form with something like heroin, and it's more potent than heroin, or it's being compressed into a pill, and people who are using it are thinking it is something equivalent to like an OxyContin. So they're actually getting a drug that is way more powerful than the drug that they think that they're getting, and it leads to a much elevated, higher risk of overdose.
And what are you hearing about the increased use of it here in Ottawa?
Well, we do know when we surveyed some people who came in to use our needle exchange program that about 40% reported in the last 3 months that they have been offered or have used powdered fentanyl. And we know from one of the latest Ottawa Police Services drug sweeps that they've reported that they picked up some powdered fentanyl at that point.
So if you are concerned and you are saying that you're afraid that there is going to be an increase in spikes of overdoses, how would a safe injection site help? How would it address that problem of people who are using powdered fentanyl, for example?
Okay, so within a supervised injection site, people would bring their pre-obtained drugs into our facility to use them in the presence of a nurse who's trained to intervene in the event of an overdose or any other adverse drug using event. And they're also trained to provide advice on safer injecting and also connecting them to medical and social services, many of which we already offer at Sandy Hill.
And how long would they stay there? Would they stay if it's a safe environment to do that? I'm just thinking that people who are hearing that, of course, they might be concerned that they take the drug, then they're back out in the community again, having their high or whatever is happening to them. Tell us how that would work.
Sure. So people would come in, they would wait in our waiting area depending on what the availability is in terms of the injecting spaces that we have. They would inject the drugs, we expect that would take maybe 15 minutes, could be up to half an hour. And then we would have them waiting in our drop-in space afterwards so that we can continue to provide some level of observation. Not all overdoses happen right away, so we want to make sure that we optimize the amount of time that people are staying within the health center so we can provide them the support that they need. And that's often at that point where we can also make some connections to other services for them.
When you have your public consultations, who will they involve?
So we've already begun some consultations with people who would use the service. So what we want to do now is we want to move that consultation into the local neighborhood around our center at 221 Nelson Street. So we'll be looking at people who live in the area, people who work in the area, and we'll also do some additional consultation with people who would use the service.
What do you hear from people who would use the service? Why do they want this?
They would like it because they do not want to be injecting in public spaces, number one. That's the main reason that people say that they would want to use this service. They don't like to be injecting in parks and on the streets, in alleyways, and in public washrooms. So their main reason is that. They are also concerned about overdose and that they don't want to die from the overdose, and they want to be in a place where they can have somebody present who can intervene in the event that they do. They also don't want to acquire HIV, and we have very high rates of HIV in Ottawa. It's about 3 or 4 times the HIV rates in Toronto within this population. So these are, the various reasons why people want, and we also know that they trust us as a service provider. That when we surveyed them about whether they would find it acceptable for the supervised injection service to be operated within the Sandy Community Health Centre, they agreed that it would be.
What kind of addiction support do you require? I mean, is it the ultimate goal to give them a safe place to do drugs, or is it the ultimate goal to get them off the drugs?
Well, the ultimate goal is to stabilize people and to provide them a safe, sterile, clean environment with supervision so that they become in a space afterwards where they can actually begin to access other services. So we have addictions and mental health treatment services on site. We have smart recovery groups. We have a methadone and Suboxone clinic. We have a medical clinic. We do HIV treatment. All these things are already existing within our community health center. And what we want to do is to be able to provide an additional service that will provide some stabilization for people so that they are in a better space to access those services.
Have you come up against any opposition from residents in Sandy Hill?
Well, we haven't started our local neighborhood consultation yet. I mean, I would expect that there would be some initial fear and concern, with regards to this. But the reality is in the 90 cities in the world where these services operate, they have the support of the local community, local businesses, and local politicians and local police. So while we understand initially what people's fear is associated with this, our experience is, and the experience internationally, is that people very quickly learn that it's not what they thought it was.
If we were to pretend for just a second that I was a resident of Sandy Hill and that I was fearful, I was concerned, what would you say to me?
Well, first of all, I would talk a little bit about what the services that we're offering and what is the nature of substance use and substance use disorder, and the nature of recovery, and how challenging it is for people who experience significant barriers to recovery to just simply stop using drugs. And that what we're providing people is a better alternative to what is existing now. So it's not a difference in this community between supervised injection and no injection. It's the differences between supervised injection and unsupervised injection. And what we really want to stop is this unsupervised injection that's happening in the public.
Rob, good to talk to you. Thanks very much for coming in today.
Okay, thanks for having me.
That's Rob Boyd. He runs Sandy Hill Community Health Centre's OASIS program, which works with drug users.